Hi guys, I hope you can hear me. I'm going to do a real quick demonstration on setting up oxygen. This again will be a very quick one, so pay attention, okay? First of all, I have it sitting up here on a counter, which is a no-no in real life. This is a pressurized gas cylinder, and if this were to fall, if this valve stem were to break off, this thing could travel through walls, could hurt people. So it always must be supported. Don't ever leave it standing up unsupported or laying down unsupported. So that's why I have this stand here. And I've moved it up so I can demonstrate it a little bit better to you than if I had it sitting on the floor. But just note that that's where it would normally be, because I can't take any chances with this getting knocked over. Okay, while I've got the cylinder in my hand, I want to point out that you'll notice it has green on it, and green signifies that this is oxygen. It could be white or silver as well, but the fact that it's green signifies that it is indeed oxygen. It also has, on the valve stem here, it has pins that are in a specific configuration for oxygen. And what that means is that only an oxygen regulator will fit because it has those pins in the exact same location. Okay, so there are different types of gases. There's helium, there's nitrogen, all different kinds of gases, carbon dioxide, and they all come in a different colored cylinder, and they all have a different regulator that attaches to them. But this is oxygen. It's green, white, or silver. It has the 2,5 pin index here, and only an oxygen regulator will fit on it. Okay? So this is our oxygen cylinder. We've identified it, and we've gotten the regulator. So now we're ready to put the thing together. I'm going to put it back in its stand. Now, this is an oxygen key. It's used to turn the oxygen on and off, okay? You can't use a wrench or anything. Well, you could, but you're not supposed to, okay? So the first thing I'm going to do, let me get this a little bit closer so you can see this. So the first thing I'm going to do with this is I'm going to make sure this isn't, the opening here isn't aiming at anybody. And I'm going to do what we call crack the cylinder. I'm going to open it up to blow any dust or debris that's in there out. Just a little bit. And this key is a little bit worn out, so I have to use the other end of it. Okay, and then I'm ready to take my oxygen regulator and put it on there. Now, you'll see right here I have an O-ring. And it's very important that you check to make sure that O-ring's in place, because if it's not, you're not going to get a good seal and you're going to get gas leak around this, okay? So I take this and I put it on so that the 2 and the 5 pin align with the 2 and the 5 pin on the regulator, which is right there. And it kind of sinks in. And then I'm going to screw this yoke right over here. I'm going to screw that down finger tight. Okay? And that's really probably all I should have to tighten it. Don't tighten it with a wrench or anything like that. Now, again, I'm going to pop it out of here for a second to show you the gauge. So this is our oxygen regulator. This gauge right here will show me what the pressure in my tank is when I turn it on. I haven't turned it on yet, but this shows you the pressure in my gauge. This here is the flow regulator. I can turn that, and that's in liters per minute. So right now it's sitting at 0. That is 1 liter per minute, 2 liters per minute, and so on, okay? So that's the oxygen regulator, and we have it attached to the tank appropriately. So I'm going to make sure it's turned off, that I have no flow in it right here, and now I'm going to turn on the tank. And when you turn on a fresh oxygen tank, don't be looking right straight at the gauge, because if something happened, if the gauge were to fail, it could pop off and hit you in the face. You don't want that to happen. So I'm going to open this thing all the way up, and then I'm going to read the pressure gauge to see how much pressure I have in there. So you'll see that it moved just a little bit. This tank is almost empty, but it did. The needle is sitting right about 600, 700. Right in that area. So I don't have much oxygen in here. It won't last me for very long, but in an emergency situation, it can be life-saving. All right, so my oxygen is set up now and it's ready to go. So depending on what device I want to use on my patient will determine which one I hook up. So let me talk about these for a minute. If I have a spontaneously breathing patient, they have their own respirations and they're breathing adequately, I just want to give them a little supplemental oxygen, maybe their saturations are a little bit low, then I'm going to use what's called a nasal cannula. See it right here, it has these two prongs, sometimes they're called nasal prongs, and the way they work is they fit in the patient's nose like this and wrap around the ears. You do not put this around their neck. You do not do this. I'm not even sure I can do this, but you don't put it around their neck like this. Because what happens when you do that is if you're moving the patient from a bed or something like that, and this snags on something, it's going to yank their head off. Not literally, but it's not going to feel very good. So it never goes on them like that. It always goes on them up the nose. And you can see, first of all, that it's curved inward. So that it goes in the nose like that, wraps around the ears, and then this little bolo tie tightens it there. Okay? And then we attach it to our oxygen source first. But I just wanted you to know that this had to. That way, if something happens and it gets tugged on the patient, it'll pull it off their ear and they won't strangle from it, okay? So this is a cannula, a nasal cannula. It's designed for low flow oxygen, usually 2 to 6 liters maximum is what we would put on our regulator to give them low to moderate doses of oxygen. Now, if they're a mouth breather, instead of a nose breather, this isn't going to work very well, but this is what we would want to start out with on most patients would be this. Now, if I had a patient who was, again, still spontaneously breathing, but they were really in a lot of distress and their saturations weren't very good, then I would probably want to go with a mask that gives higher concentrations of oxygen. And this is a non-rebreather mask. It has a bag on here that fills straight with oxygen. So when they breathe, the oxygen comes straight out of the bag and into their nose. But when they exhale, this little valve slams shut so it doesn't mix with their exhaled air. That's why it's called a non-rebreather. They don't rebreathe any of their exhaled air. It's all fresh oxygen every time they take a breath. Now, so this gives a much higher flow. This gives close to 100% oxygen. You can give anywhere from 95 to 99% oxygen. So it's designed for patients who are in a lot of distress but still adequately breathing. I'll demonstrate this one here in a second for you, but just keep in mind that nasal cannula gives low to medium concentrations of oxygen at 2 to 6 liters per minute, and the non-rebreather gives high concentrations of oxygen, and it has to be at least 10 to 12 liters per minute. So we have to really crank up the volume on our flow regulator, okay? So that's a non-rebreather. Now, if an emergency occurs, now you've had CPR, so you should be familiar with this device. If an emergency occurs and you have to breathe for your patient because they're not breathing well enough, then this is the device you would use, a bag valve mask. It has a bag, has a valve, has a mask, and this forces air into the patient. And the oxygen source here, let's see, the oxygen source has been cut off, but it would plug in right here. So I don't have the tubing on this one, but it would plug in right there, and then it would inflate this bag with oxygen, and then we could deliver it to our patient forcefully. But again, that's only for patients who are not breathing at all, or their respirations are ineffective. They're not taking big enough breaths, or they're not taking them often enough. I can assist them with this, okay? But again, you should have had that training in your CPR class, okay? All right, so let's go to hook up oxygen. And we'll start by using the nasal cannula. And one thing that I always want to make sure of when I'm putting oxygen on anybody is that I have attached it to the oxygen source, and I have the oxygen flowing through it before I put it on them. And when I go to take it off of them, I want to make sure that I take it off of them before I disconnect the oxygen. Because I want it flowing to the patient anytime they're on it. Okay? So, here's how we do that. There's a little nipple adapter right here. Right there. And that's where I'm going to attach my oxygen tubing. Okay? And now I'm going to dial in my flow, and let's say we want our patient on 2 liters per minute. That's 2 liters per minute. So that should be flowing. My gas source is on up here, so that should be flowing. And if I put my ear up to here and put my finger over it, I can hear air hissing out of there, or oxygen hissing out of there, okay? And then I'm ready to put it on the patient, okay? And then fasten it down, okay? When I go to take it off the patient, again, I don't do anything there yet. I take it off the patient first, then I turn it off here, and then I can disconnect this and it goes with the patient to the hospital. Okay, again, I can go up to 6 liters with it, but that's kind of uncomfortable. So generally 2 to 4 is standard. You can go up to 6 with it. Now let's say I have a patient who's in a lot of distress. They're still breathing spontaneously, but they're just not getting enough oxygen. Then I'm going to use a non-rebreather mask. And the trick with this mask is that since they breathe straight out of this bag, anytime they breathe in, I don't want this bag to collapse more than halfway. If it does that, then as they take subsequent breaths, this thing is going to quit delivering oxygen to them. So I want to make sure that this has a good flow of oxygen flowing through it before I put it on them, and then prior to taking it off of them as well, okay? And I need to monitor their respirations to make sure that this is giving an adequate enough flow. If not, I'll turn up the flow on this thing to increase that flow rate. So, once again, I attach it to here. Now this thing has to run at least 12 liters per minute, so I'm going to turn the volume up. I've got 10 and 15 as my choice, so I'm going to go with 15. I'm going to put my fingers over this valve right here to help inflate that bag. And then when it's fully inflated, I can put it on the patient. Okay. Now, that's what happens when I breathe in. Well, let me make it try to seal. So as I breathe in, the bag collapses. And it shouldn't collapse more than halfway when I take in that breath, okay? So you want to make sure that if it starts to collapse more than halfway, if this bag starts to deflate, then you add more flow to it, okay? Again, take it off the patient first, turn off the flow, and then that goes with the patient to the hospital, okay? Once you're done administering oxygen, and again, this is used in an emergency setting in any area that you're going to be working in. So you're going to want to check this at the start of your shift to make sure it has oxygen in it. And don't leave it turned on up here, or it may bleed out over time. So I'm going to turn this off. It's off now. I'm going to bleed what's left in the regulator out until there's no air or no oxygen flowing out of it. Okay? And then it's ready to go. And I'm going to turn this flow back to 0. So that at the start of your shift, when you get there, you want to make sure that you've got oxygen in here and make sure that it's enough. If you're down to about 1,000, then I would probably go ahead and change it out, because when you're going to need it, you're going to need it, and you don't have time to change it out then. So make sure you check at the beginning of your shift each time. And once again, after you've checked it and turn it off there, you turn the flow off there. Okay, so that is the quick 14-minute version of how you set up oxygen for a patient who is in need of it. And I'll be back with you later on.